the hospital in Bardwan, the Bardwan Medical College, we found beds, 124 beds in one pediatrics room, not separated by any curtains. The mattresses were covered in Chips Ahoy wrappers and Airheads candy wrappers. Walls had blood on them. It was not an ideal place for children and for newborns.
Due to lack of medical care, people in small towns and villages usually end up traveling long distances to get basic health care.
Hello, I'm Priyanka. I'm an architect from India, currently pursuing my Masters in Urbanism Studies at KTH, Sweden. The UIA PHG Competition provided us an opportunity to understand and address a serious social crisis in our country through a simple, effective, prefabricated modular design for a community healthcare center. I thank the organization and the jury for recognizing our effort and awarding us with the first prize.
The CHC design addresses the urgent need to construct healthcare units across India, taking Chikballapur in rural Karnataka as an example project. The main design goals were to respond to the complex hospital workflow in creating a prefabricated prototype that could be contextualized anywhere across the country, incorporating local labor and materials, providing an ambient patient and staff-friendly environment. The design also addresses the acute electricity and water shortage India's villages often face by incorporating renewable energy and passive building techniques. The units were organized according to functional requirements, creating two major nodes and axes. The linear blocks were then oriented along the north-south axis to reduce solar heat gain. The blocks were staggered to create courtyards and open verandas, resulting in green pockets in all waiting zones. The roof area was maximized for shading and harvesting rainwater. All the units follow a modular grid for ease of prefabrication. The plan reflects this idea of a hospital with no corridors, relying on naturally breathing structural systems. The main structure comprises of prefabricated lightweight steel sections with infill panels. All units follow the 1.2 meter grid, which is ideal for the Indian prefabricated industrial market size. All factory produced components are transported by road and fixed on site by local laborers. 2.4 x 1.2 meter panel is the most commonly available size, making the design flexible to adopt different materials according to the context. Local materials such as rammed earth, clay pots, bamboo panels incorporated into the prefabricated design add relevance and cultural value. A double roof reduces heat gain, allowing rainwater harvesting and tapping solar energy. The CHC design also focuses on renewable energy, water strategies, and passive building techniques for thermal comfort and ecological sustainability. The open verandas and waiting areas further reduce occupancy loads inside the patient zones. Bright, vibrant colors were added to the fenestrations in order to make the environment playful and easier for wayfinding. In India, many patients are often accompanied by family members awaiting the outcome of their loved ones. Responding to the socio-cultural context, large, open family waiting spaces overlooking green courtyards were conceived as an integral part of the plan. The project thus envisions deinstitutionalizing the institutional experience of rural healthcare settings through design.